psychologist of all time because he helped me in a certain way see this thing from a different angle. And I couldn't help when making these slides but think about how he viewed the past, present, and future at various times in his career. Now, I think he had some mental trouble at certain times in his career, personally, from my perspective, but I do not think he was in a bad mental spot for his whole career. There are many instances where he was very positive and had, very good handle on things, as far as I know, right? But a couple quotes by him. Don't ask me about the past, it was all bad, is in one song. I don't suffer so much, I'm feeling shell-shocked, in another. That's the present, right? And I've seen the future, and it's hopeless, okay? Not a good place to be, right? We'll later turn to the non-depressed Tupac so we can feel a little better about him. But he really got me at various times with the song lyrics. I'll even share one thing he said at the beginning of one song that was like, woo! He said, in paraphrasing in more civilized language, I engage in drug use to eliminate the pain, because if I was not under the influence, I would probably engage in self-harm because I am hopeless, is what he said, right? So he actually said that, though. A lot of, people that I think suffer from these things don't have it in them to articulate that, and that's why I liked him so much, okay? It really caused me to identify at various phases, all right? Dr. Jung's methods for the emotional type depression. Give it form, okay? I'm not sure how effective these are, but he did recommend this, so I wanted to put it down, okay? He's a brilliant guy. And he said stuff like painting, journaling feelings, symbolic expression, right? So, how would we do this? What's an example? I have an old example and a modern day example, right? A girlfriend or boyfriend dumps you, right? So the guy, his girlfriend dumps him. He's miserable, experiencing both grief, depression, wishing it had been different, thinking about what he could have done. If I was only more attractive, if I was only better at this, if I only behaved a certain way, if I'd only, done this, that, or the other, it could have worked, right? But she ran him through with a stake to the heart, right? So you could draw a picture of that, just his girlfriend ramming a big metal or wooden stake through his heart. I don't know, but did that really happen? No, but could it capture the feeling on paper and get him to, bring some emotion to the surface? Carl Jung's method, not mine, okay? But I like the method, and I've done this before, of videoing yourself complaining, wailing, crying, thinking about, talking about how bad they screwed you over in certain situations, and then you don't rewind it. We don't rewind anymore, but you watch it, right? You can delete it afterwards, but I was very surprised at the insights I had when I did that a couple times, right? It was like, who is this poor, suffering fool who is totally missing the point, was frankly what occurred to me at, various times. I'm not saying that would be the case in all cases, but that did happen to me at one point. And I really like that exercise. We can do it now with webcams and stuff. That wasn't really available in the old days, right? So watch it. You might be surprised what you see, right? And that, I think, is my best way of making it real, giving it form. So this type of integration can restore our orientation, allowing us to make better meaning out of life. Again, we'll get to that later. Making the unconscious conscious. How do we do this? Therapy, inner exploration, reflection, analysis, right? Now, I'd like to point out that even though psychoanalysis has gone out of style, therapy is not. And a lot of therapy, it's, the patient's choice, if they want it to be, what they address. So addressing certain things, I think, can be a lot more beneficial than others, okay? So in terms of inward exploration, I wanted to give the Buddhist tips, even though we have a different section on Buddhism. Buddhist tips were look at things like aging, acquisition or ownership, right? Analyze these, okay? Things that you desire, really want, craved in the past, crave in the future, crave right now, right? Examining those can indirectly lead us to other stuff, losses, inward anger, etc. All right, so that's just tips if you want to dig deep. Now, don't dig too deep. If you stumble on something, address it and try to process it is my advice, rather than keeping on digging, because you might find something after that, enlarge the context around it a little more, and then you have something worse, more upsetting, and you haven't even processed the thing on the lower level yet, right? So when you see something, think about it, address it, take your time. Okay, if you're real smart, you might think of something too fast, and it can be upsetting. However, I can almost guarantee you, I can't guarantee you in all cases, but I think if you take the right angle at approaching it, you can put it into a better context and kind of make the suffering not in vain, which is our basic formula, in a sense, that we will again get to later. Right? So give the undefined shape, form. Remember, our model goes beyond the psychological phase, though it is of high importance. Right? But is this all? Or was their focus a little bit too narrow and just strictly psychological? Can we do more to treat depression, is a question. I think we can, and recall our fourfold model, and it is just, a model that is easy for the depressed patient to remember. It's got its flaws, etc. It doesn't really address emotions, which occur somewhere between the physical and mental, I think, right? But the physical is the first layer, mental or psychological, the second layer, which these guys addressed very well, I think. Social, though, they did not really address treating depression on the level of social, right? Socialization with positive people, good relationship with work, things like that. They may have touched on it, but I don't think they really got it, like our later slides on our next thinker will show how he addressed it, okay? Aldous Huxley, right? So I think we can do a little more. Again, our model was physical, mental, social, and spiritual, okay? That is it for these guys, right? I just wanted to make elucidate kind of what they said enough, but not too deep, not go too deep, so that somebody could take this and perhaps do some psychological work on themselves and get somewhere that they haven't got before in this area, this piece of the puzzle. Okay, I mean, you want my opinion? I think rather than say, oh, it's 100 years old, outdated, and they're wrong, I'd say like, whoa, 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 they got the psychological piece in my mind, like they hammered on the head pretty well, I think. But there are other ways and more complete ways to treat depression. And what we want to do is, because the real cause is still unknown 100 years later, we want to treat it on as many levels as possible so that we can kind of bypass knowing the cause itself. If we do everything we can to treat it, then we may be addressing the cause, right, without knowing what it is. Because the cause, I don't think, is particularly exactly known at this point in time in history. But you want another example of loss that was pretty big? Anyone get depressed during COVID? Where's the loss there? You lost the ability to live normally, right? You had to walk around with a mask on, stay home all the time. It was just not psychologically healthy, I think, for a lot of humans. A lot of relationships failed during that time. And it's just an example of loss that I thought of recently, okay? COVID, the loss of normal life. It was horrible for a lot of people, okay? Even if they didn't, experience the horrors of the actual symptoms of COVID itself, they were affected in a way psychologically that could have caused, great depression as far as I'm concerned. So that's just an example to think back to. But I'll let one do their own exploration into this if they want to. There's no pressure, however, I think it helps on addressing depression on the psychological level. So thank you very much, and we'll continue later. All right, I hope this is a good, helpful presentation on the psychology of the whole piece. All right, so thanks, do your best with it, and we'll talk soon.